Welcome back, everybody, to another deep dive into the top healthcare and tech news today.
Yeah, it's going to be a busy one, looks like.
Definitely seems that way.
Uh,
We've got a lot to cover today, so let's jump right in with Medicaid.
all right.
It's making headlines because the House of Representatives just approved a budget resolution,
Hmm.
and this could lead to some pretty big cuts to the program.
Yeah, this budget resolution doesn't specifically call out Medicaid,
Right.
but it does kind of set the stage for potential cuts down the road. And this has a lot of people concerned, especially groups like Health Access California.
Yeah, they're worried about the impact this could have on millions of Americans who rely on Medicaid for their health care.
Absolutely. It's a major safety net for so many people. One article even called it a plan to cut health care for millions of Californians.
Wow, strong words.
Yeah.
And they're especially concerned about states that expanded Medicaid under the Affordable Care Act.
Right. States like California could be hit particularly hard by these potential cuts.
So what could the fallout from these cuts actually look like?
Well, the KFF put out an analysis, and it paints a pretty stark picture.
Oh,
Yeah, they estimate that the proposed cuts could shift a whopping $44.3 billion in costs to states that expanded Medicaid.
wow, that's a huge burden to put on states.
It is, and it means states would have to make some really tough decisions. They might have to reduce benefits or limit eligibility for Medicaid.
And in a worst-case scenario,
Some states might even have to consider eliminating the program altogether.
that'd be devastating for so many people.
Absolutely. It would leave millions without access to essential health care. And KFF didn't just look at the numbers. They went directly to the people who would be most affected by these cuts.
That's really valuable insight.
They conducted focus groups with Medicaid enrollees.
Interesting.
And what's really striking is that there's this shared anxiety across party lines.
Really?
Oh, yeah. People are worried about losing access to care. They're concerned about the financial burden shifting to states, which could lead to higher taxes or cuts to other vital programs.
It's a reminder that healthcare policy isn't just about numbers. It's about people's lives.
Exactly. And these decisions have real human consequences. So, yeah, it's definitely a complex issue with far-reaching implications.
Absolutely. And we'll need to follow this story closely and see how it develops.
Yeah.
Now let's shift gears to a topic that's also making waves. Telehealth.
Okay.
Key telehealth services for Medicare patients are actually set to expire next month unless Congress acts.
Yeah, this is a really critical moment for telehealth. It's been a lifeline for so many people, especially during the pandemic.
For sure. And hospitals and healthcare advocates are urging lawmakers to extend these policies.
Hmm. They're arguing that telehealth is essential for modern healthcare access, especially for seniors and people in rural areas who might have difficulty getting to in-person appointments.
That makes sense. One advocate even called it a bipartisan issue with broad support, and they're urging Congress to vote for its continuation.
I think there's a strong argument to be made that telehealth has become a cornerstone of healthcare. It's not just a temporary fix anymore.
Yeah, it's really shown its value over the past few years, allowing people to manage chronic conditions, access mental health services, and even receive some primary care remotely.
Right, and letting those policies expire would be a huge step backward in terms of healthcare accessibility.
Definitely seems like Congress has a tough but important decision to make here.
Absolutely.
Now let's move on to something that always sparks excitement and debate. Artificial intelligence.
Uh-huh.
Eli Lilly just made a huge announcement. They're investing $27 billion in 4 new U.S. manufacturing plants.
Wow, that's a major investment. And it's a clear sign that the pharmaceutical industry is really embracing AI in a big way.
Yeah, and a big driver behind this is AI's potential to revolutionize drug manufacturing. Imagine faster drug discovery and development and a future where personalized medicine is more widely available.
That's the dream, right?
Absolutely. And it feels closer than ever, especially with some of the recent advancements in AI. And speaking of advancements, there's a really interesting article about a new AI model that analyzes EKGs to identify women at higher risk for heart disease.
Oh, wow, that's incredible.
Yeah, it has the potential to drastically improve outcomes for women who are often underdiagnosed when it comes to heart disease.
Imagine a world where an algorithm can detect subtle patterns in your EKG and spot risks that even trained cardiologists might miss.
That's the power of AI. But with this power comes a lot of responsibility.
Absolutely.
Experts at the VVA 2025 conference emphasized the importance of responsible AI implementation. They stress the need for high-quality data and transparency around how AI reaches its conclusions.
Transparency is key. If patients don't understand how AI is being used in their care, they're not going to trust it.
Exactly. It's all about maintaining that patient trust, especially when we're talking about something as important as healthcare. And John Holomka, the president of Mayo Clinic Platform, actually warned about the risk of AI hallucinations.
Oh yeah, that's a scary thought.
It is basically where the AI generates a result that seems plausible, but isn't grounded in reality.
It just goes to show that human oversight is still essential even as AI becomes more sophisticated.
Absolutely.
Yeah.
We can't just blindly trust the output of an algorithm, especially when people's lives are at stake. Now let's talk about something a little less glamorous, but equally important: the financial health of the healthcare industry.
Okay.
And it's not exactly a rosy picture. It seems many hospitals are still struggling to bounce back from the pandemic.
Yeah, a recent report found that a staggering 37% of U.S. hospitals are still operating at a
That's
loss.
a huge number.
It is. And it really highlights the lasting financial strain that the pandemic has had on the healthcare system.
And it's not just the pandemic.
Yeah.
There are a lot of factors contributing to this financial instability.
Right. We've got physician pay cuts on the horizon. The growth of Medicare Advantage is slowing down.
Right.
And of course, there are those potential Medicaid cuts that we talked about earlier.
It all adds up to a pretty uncertain future for the financial health of the healthcare industry.
It does. And this is where those Medicaid cuts become even more concerning. Safety net hospitals that serve a large proportion of Medicaid patients could face even more strain.
And that could have ripple effects throughout the entire healthcare system.
Exactly. It's all interconnected. Yeah, it's a pretty complicated situation. And it makes news like this IPO from Kestra Medical Technologies even more interesting.
Kestra Medical Technologies.
Yeah, they're a company that specializes in wearable heart devices.
Yeah.
And they're going public with the goal of raising $155 million.
That's a significant investment, especially given all the financial challenges we've been talking about.
It is. And I think it shows that investors are still really optimistic about the future of wearable health technology.
It makes you wonder what makes Kestra's technology so special.
Well, their devices are more than just basic fitness trackers. They actually use advanced sensors and algorithms to provide real-time insights into a person's heart health.
So it's about more than just counting steps.
Exactly. Think early detection of arrhythmias, personalized feedback, and seamless data sharing with healthcare providers.
That's pretty impressive. It seems like we're moving towards a future where people can be much more proactive about their heart health.
Right. It's all about empowering patients to take control of their own well-being.
It's a really exciting development, and it fits into that larger trend of personalized, data-driven healthcare that we've been seeing.
Absolutely. But it also raises some important questions.
Like what?
Well, all these wearable devices are collecting a ton of sensitive health data.
That's true. So how do we ensure the privacy and security of all that information?
That's a huge issue. Data privacy has to be a top priority as these technologies become more widespread.
Absolutely. We need strong security measures and clear regulations in place to protect patient information.
And transparency is crucial. Patients need to understand how their data is being used and feel confident that it's being handled responsibly.
It's a delicate balance. We need to harness the power of technology while also safeguarding people's privacy.
That's the key to the future of healthcare, finding that balance. Now, shifting gears a bit.
Okay.
There's a fascinating story about Tampa General Hospital. They're using military-grade technology in their operational command center.
Military-grade technology.
Right.
In a hospital.
Yeah, it's pretty cutting-edge stuff. They're using real-time data and advanced analytics to optimize everything from bed management to supply chain logistics.
Wow. It sounds like something out of a sci-fi movie.
It does, but it's a real example of how hospitals are using innovation to tackle the challenges they face.
And it has the potential to make a big difference for patients.
Absolutely. Greater efficiency, reduced costs, and ultimately better care. That's the goal.
Now let's talk about something that's been a major concern across the healthcare industry: staffing shortages.
Right. This is a big one. The CFO of Sharp Healthcare recently emphasized the need for investing in recruitment and retention.
It makes sense. Healthcare workers are the foundation of the entire system.
Exactly. We need to retain experienced professionals, attract new talent, and create supportive work environments.
Otherwise, the system simply can't function.
Especially as the demand for healthcare services continues to rise.
It's not a sustainable situation if we keep losing valuable healthcare professionals.
Nope, not at all. Now, another big player making headlines is Oracle Health.
Oh, yeah. What are they up to?
Well, they're continuing their EHR rollout for the U.S. Department of Veterans Affairs, and they're also making some progress on the interoperability front.
That VA-EHR project is a massive undertaking.
It is. And if it's successful, it could really transform healthcare delivery for millions of veterans.
It really highlights the crucial role that technology is playing in healthcare.
Absolutely. And speaking of technology, Black Book Research just released its rankings of the top tech platforms for value-based care and population health.
What does that tell us?
It shows that the industry is really focused on using technology to improve outcomes and manage costs.
And it's all tied to that shift towards value-based care.
Right, moving away from fee-for-service models and towards a system that prioritizes quality and efficiency.
That's a good thing, right?
It's definitely a step in the right direction. It's about putting the patient at the center of the healthcare system.
Now, before we move on, we need to address a serious development. There's been a measles outbreak that's unfortunately resulted in the first known U.S. fatality since 2015.
Oh, wow. That's heartbreaking.
It is. And it's a sobering reminder about the importance of vaccination and public health measures.
We can't afford to become complacent when it comes to public health.
Even in 2025, preventable diseases can still have devastating consequences.
Absolutely. Now, circling back to AI for a moment,
Okay.
we've talked about its potential in drug discovery and heart health. But experts at the VIVE 2025 conference were really emphasizing the need for responsible AI implementation across the board.
That's important. As AI becomes more powerful, we need to make sure it's being used ethically.
Exactly. And transparency is key. Patients need to know how AI is being used in their care and be confident that it's safe and effective.
It's a big responsibility for everyone involved.
Yeah.
Now let's shift gears back to the financial side of things.
Yeah.
We've talked about the challenges, but there are also some positive developments happening.
Like Kestra Medical Technologies going public. They're aiming to raise $155 million through their IPO.
Kestra Medical Technologies. That name rings a bell.
They specialize in wearable heart devices. So yeah, it's a pretty big deal, especially considering the tough financial climate we've been discussing.
It definitely seems like investors are betting big on the future of wearable health tech.
They are. And for good reason, Kestra's technology is pretty innovative.
What makes it so special?
Well, their devices go beyond just basic fitness tracking. They use all these advanced sensors and algorithms to provide real-time data on a person's heart health.
So we're talking more than just steps and calories burned.
Oh yeah, much more. They can detect things like arrhythmias, provide personalized feedback, and even share data seamlessly with healthcare providers.
Wow, that's amazing.
Yeah.
It seems like we're getting closer and closer to a future where people can really take control of their own heart health.
Yeah. Exactly. It's all about empowering patients, giving them the tools and information they need to stay healthy.
And that aligns perfectly with this whole movement towards personalized, data-driven healthcare.
Absolutely. But of course, it also raises some new challenges.
Like what?
Well, all these wearable devices are collecting a ton of sensitive health information.
It's a valid concern. So how do we make sure that data is kept private and secure?
That's a crucial question. We need to have really robust security measures in place and clear regulations to protect patient data.
And transparency is key.
Absolutely. Patients need to understand how their data is being used and trust that it's being handled responsibly.
It's a balance we have to strike. Harness the power of technology, but never at the expense of patient privacy.
Agreed. That's the future of healthcare, finding that sweet spot.
So as we wrap up this deep dive into the day's top healthcare and tech news, what are the big takeaways for our listeners?
I think the main thing is that the healthcare landscape is changing rapidly.
For sure.
We're seeing incredible innovations in areas like AI, telehealth, and wearable tech.
And at the same time, we're facing serious challenges like financial pressures and workforce shortages.
Yeah, it's a complex and dynamic environment.
But one thing's for sure, staying informed is more important than ever.
Absolutely. These stories we've talked about today, they're shaping the future of healthcare. And they affect all of us.
It's up to each of us to stay engaged and informed.
Advocate for policies that make healthcare more accessible and affordable.
And embrace innovations that empower patients.
Exactly. That's how we build a healthcare system that truly works for everyone.
Thanks for joining us on this deep dive into the latest healthcare and tech news. We'll see you next time for another exploration of the news that shapes our health and well-being.